Welcome to our presentation on diverticular disease in older adults by Alicia Hurren and Jessica Southern. In this scenario, Mr. Johnston is a 67-year-old man. He came in with a complaint of lower left abdominal pain. He has had changes in bowel habits such as constipation and diarrhea. He smokes a pack of cigarettes a day and takes aspirin for left knee pain. He frequently eats fast food and only drinks a cup of water a day. He enjoys popcorn and nuts as a snack at bedtime.
Diverticulosis is the presence of diverticula, which are small outpouchings that develop in the colon wall, which is the lining of the intestine as we age. It occurs more frequently in the lower section of the sigmoid colon, located on the lower left quadrant. Diverticulitis occurs in individuals with diverticulosis. The increased pressure from retention of hard stool and bacteria causes the colon wall to thin and break down. The diverticula become inflamed, causing ballooning through the wall of the colon.
The types of diverticulitis are as follows. There is simple, which accounts for the majority of cases, responding to treatment with no complications. Complicated diverticulitis, if left untreated, can result in complications such as abscess, fistula, obstruction, peritonitis, and sepsis, which may result in surgery.
Here's a visual diagram of diverticular disease. As you can see here, the outpouchings of the intestine, known as diverticulum, can result in inflammation where bacteria and food particles can get stuck, resulting in diverticulitis. With age, the large intestine walls become thinner and weaker, making it the most prevalent GI disease in older adults. This is an incidence of about 50% in older adults 60 years of age and 65% in older adults 85 years of age. 10 to 25% of diverticular disease can result in diverticulitis flare-ups.
Now we will be discussing the warning signs of diverticulosis and diverticulitis. Diverticulosis is mostly asymptomatic or have symptoms similar to irritable bowel syndrome, including alternating periods of diarrhea and constipation. It can also lead to diverticulitis or diverticular bleeding. Diverticulitis depends on the degree of inflammation. Common symptoms include cramping, abdomen pain in lower left abdomen, which is relieved by passing gas or a bowel movement. A small tender mass can be palpated by the care provider in the left lower abdomen. Fever, chills, nausea and vomiting, anorexia, frequency and burning when urinating may also be present. Here's how we diagnose the disorders. It can be difficult to diagnose diverticulosis due to nonspecific symptoms that are also associated with irritable bowel syndrome and other GI disorders. Diagnostics include an X-ray involving a barium-containing enema that allows the colon to be more visible. A colonoscopy involves a tube with a light and video camera to allow a better view of the colon. However, when there are flare-ups, it may be too painful to complete a colonoscopy, and it may cause bowel perforation, so a CT scan is preferred.
Now, who is at risk, you say, Mr. Johnston?
Some non-modifiable risk factors include older age due to the large intestine walls becoming weaker, genetics, sex, women over the age of 50 and men under the age of 50 with increased risk of complications. Modifiable risk factors include a deficiency in dietary fiber. Without fiber to add bulk to the stool with absorption of water, the stool makes it harder to pass in a bowel movement. Medications. Aspirin, NSAIDs, and corticosteroids increases the risk of a flare-up. Geographic. It is known to be more common in developed countries. Conditions. HIV, chemotherapy, and obesity. Lifestyle factors. Smoking, alcohol, and lack of exercise.
To treat diverticulitis flare-ups, a clear liquid diet, which can include tea, coffee, broth, popsicles, gelatin, fruit juice without pulp, physical rest, and IV or oral antibiotics are recommended. Once the body recovers, the patient will be able to eat low-fiber foods without seeds or skin.
When you have diverticulosis, it is especially important to have a proper diet to prevent diverticulitis.
Consuming high-fiber meals as per the Canada's Food Guide, for example, fruit and vegetables as listed. Adequate fluid intake helps to prevent bloating, gas, and abdominal pain, at least 8 cups per day. 20 to 35 grams of fiber daily is recommended.
Treatment options for diverticulosis include medications and supplements as listed.
It is important to know when to seek help to prevent complications.
Seek medical attention when you have a fever of 38 degrees or higher, have severe and worsening abdomen pain, and fluid intolerance. In rare cases, diverticulitis can be a warning sign for colon cancer, so ensure you follow up with your physician for a colonoscopy a few months after you recover. Thank you for listening to our presentation.